So having a guide going through this process is optimal for doing it. Even though you can go look online, you can find all sorts of stuff. Likely a lot of the failures are because of it is a tricky process.
Welcome back to another episode of the Peak Performance Life podcast. And today I'm very excited. We have a special guest. She has amazing credentials. I'll try to read just a few of them here. Probably take too long to read them all because it's just such an amazing long list of accolades here. We have Dr. Elizabeth Yurth, who's the co-founder and medical director of the Boulder Longevity Institute, where she's been providing tomorrow's medicine today to her clients since 2006. Dr. Yurth is a double board certified in physical medicine and rehabilitation, as well as anti-aging and regenerative medicine. She has a Stanford affiliated fellowship in sports and spine medicine and a dual fellowship in anti-aging and regenerative medicine and anti-aging as well. She's completed over 500 hours of continuing medical education training in the areas of longevity, epigenetics, which is a good one. I'd love to chat a little bit about that as well. Nutrition, bioidentical hormone replacement therapy, regenerative peptide treatments, and regenerative orthopedic procedures. As an athlete herself who has dealt with numerous injuries, Dr. Yurth is thrilled to share with her clients all the innovative, life-changing treatments that are on the cutting edge of medicine. So thank you so much for joining us.
For inviting me. Appreciate it.
Awesome. So great. Do you want to just start out by giving a little background about what you're doing at the Boulder Longevity Institute, some of the main things you're working with clients on there?
I'd love to. Let me give your listeners a little bit of background about myself. So I've spent 30 years in the sort of traditional practicing orthopedic medicine, and people coming in with injuries and back pain and knee pain and shoulder pain and treating in sort of the traditional fashion that all you guys are used to, which is sticking some steroids in your joint, putting you in physical therapy. Ultimately, you're not getting better, doing surgery, and ultimately that's not getting better, and finally replacing your joint or fusing your spine or whatever. So I spent 30 years doing that. About 17 plus years ago, I sort of started getting a little disillusioned because all I did was see people come back with not really better. They're like, well, I guess I'm okay, but I still can't do my sports. I still can't do this, and so, obviously if you just break a bone, there's a place for orthopedics. So putting a bone back together with nails can be helpful. But if you have an arthritic joint, we don't really have a great way of managing that in orthopedics. It really doesn't work. We know that actually we make things worse when we do arthroscopic surgery. We know we make things worse when we put steroids in it. So after 30 years of doing this, where I feel like, geez, am I really doing more harm than good? I started getting interested in how do I actually make people healthy? And that started me down the whole road of getting fellowship trained in regenerative and anti-aging medicine. And how do we make people healthy so that they could actually heal and recover from injuries? So I sort of tried to combine that into my traditional medical practice of I'd see patients who came in with their shoulder pain or back pain and say, oh, well, let's talk about your health and your nutrition and how hormones are affecting this. And then I realized you can't do that in 15 minutes. So we actually opened Boulder Longevity Institute about 17, 18 years ago now. And what I would do is sort of see people on this 15-minute insurance-based time slots. And then I'd tell them everything I could, but if they really wanted to learn, they would come over and see me over at my other clinic. And then about a year ago, just really couldn't do both and brought all the orthopedic side into our longevity clinic. And now the Boulder Longevity Institute has sort of several arms. So we kind of realized that all of this overlaps, that your arthritic orthopedic joint injuries are the same as your gut pain or the fact that your brain's not working as well or you're getting fat. Those are all the same problems. So what we do at Boulder Longevity Institute is we take clients, and lots of them super healthy people who just want to live forever and be really healthy, and lots who have problems, joint pain, gut pain, dementia, whatever it might be. And we look at every aspect of their health. We look at their cardiometabolic status. Is your glucose perfect? Is your insulin perfect? Do you have really low cardiac inflammatory markers in general? So we look at all that. We look at optimizing thyroid. We look at optimizing hormones. We do full intracellular micronutrient profiles. So we start with this kind of basics of getting everybody into as optimal a state as they were. And that means looking at, your labs as though you were 20, not 40, so that we can get you back. When your doctor looks at your labs, they kind of go, oh, that's normal. and very few normals are optimal. So we try and get everything into an optimal range. When you were functioning at your best, when you could heal, when you could run fast and not hurt yourself, when you could lift heavy things and not feel like, oh, now my back hurts. So we try and get everybody in these optimal states. And then, we work with them together to say, okay, well, now what else do we need to do? So, once we have you optimized, maybe you're still having some issues. So now we may have to address that further, which we can do with the use of, sometimes regenerative therapies using stem cells, platelet cells, all sorts of regenerative therapies. Sometimes we use a lot of peptide therapies. I don't know if your listeners are familiar with peptides. The peptides our body makes a lot of peptides. There's short chains of amino acids. So a protein is greater than 50 amino acids. A peptide's less than 50 amino acids, some as little as 3 amino acids. But they're just a chain of amino acids that have very, very specific functions in our body. So for instance, let's say you're still having a lot of persistent gut pain, even though we feel like everything's optimized. You can use peptides like something called BPC, body protective compound, which is a gastric peptide that your gut makes. So we can use peptides like that, or what's called KPV. These are peptides that actually start healing things. So we can sort of add all of these things into the mix until we get people into these super healthy states. And then once they're there, help them maintain it. So that's sort of the paradigm of Boulder longevity. But what I'm going to add is our biggest sort of goal is to bridge so medicine has this issue, this problem, and that is that it takes about 17 years for something to be deemed medically safe and effective and to actually reach being utilized in any fashion by your physicians. Insulin is a classic example. Insulin was discovered about 18 years before it was ever put into practice. So you think, oh my gosh, insulin is a peptide. It's a simple peptide. They discovered it. They found it was super successful at saving lives for all these type 1 diabetics, right? And yet it wasn't brought to the medical world for 17, 18 years. And there's a lot of reasons for that. Part of it is physicians are very slow to adopt new things. Part of it is pharmaceutical companies and working within that institution. So our goal is to bridge that gap. So I'm really fortunate to be involved with a group of physicians that's sort of a mastermind group that works with researchers that have, been finding these things. And now we can say, hey, they're safe, they're effective. Let's bridge that gap, find compounding pharmacies, people who will make us some of these things much before they can be brought to the world, and get them to our clients at an earlier stage. So one of our other goals is bridge that research to clinical step.
Nice. Yeah, that's very, very interesting. I never even thought about insulin as a peptide. That's really interesting. Yeah,
it's funny. There's a lot of things you don't even think of are peptide, that we use as drugs. So there's a lot of drugs out there that are actually just peptides.
Very interesting. Yeah, I've been hearing a lot more about peptides, including BPC 157, which has become a pretty common one.
Yep.
I even saw recently that they started making orally, right? You could take them. What's your thoughts? Just quick question for those who know a little bit about peptides. Is it still going to be effective orally, or do they mostly need to be injectables?
So very few peptides are effective orally because they're these short chains of amino acids. They're broken down as soon as they hit your GI tract. So, and I know there are some people pushing oral peptides, but I will tell you for the most part, that's hogwash. You cannot take a peptide orally. BPC, and there's a few other exceptions as well. KPV, there's other things. There are a few that are gastric peptides that are actually stable in the GI tract, BPC being one of them. So BPC comes from our GI tract. It's stable. It's a gastric peptide that's stable, not broken down by gastric juices. It's perfectly effective orally. I actually use it orally primarily in anybody who has GI stuff. It's great for healing ulcers, colitis. It's really protective if you're taking anti-inflammatory drugs to protect the GI tract.
Like antibiotics or something like that?
Yeah, antibiotics or tons of ibuprofen, maybe you're taking for, joint pain, something like that, which we know is destructive to the gastric mucosa. You can protect that using BPC. So it is perfectly safe and stable to be used orally. I do like it as a subcutaneous injection when I'm trying to use it to heal joints, tendons, muscles, because it's great for that as well. And I think it has a little bit more bang for its buck when you do it subcutaneous injections for other problems. But for the gut, it's great orally. KPV is another peptide that it's a gastric peptide as well that can be utilized orally for helping heal the GI tract, even helping heal chronic infections in the GI tract. So there are some, but be cautious because there's a lot of people out there. And I know there's a company that's bringing to market a lot of oral peptides. There's almost no data to support that most of these peptides can be taken orally.
Yeah. And I know another big thing with these, I actually heard of a buddy of mine just told me he gained a ton of muscle. I think over 10 pounds of muscle in a very short period of time, taking MK677, I think it is. That one, which is quite interesting. So people are using it for performance, but I definitely want to give the listeners a word of caution here. There's been a lot of websites, like if you just do Google searches and find a random website, that's not a good idea to probably purchase from those websites. You want to be working with someone. These peptides, from what I'm hearing, are very powerful, very effective, but you have to really know which ones to use, how to use them, where to get them from, and so you definitely want to be working with some sort of, physician or longevity clinic like the Boulder Longevity Clinic. Yeah, definitely just want to put a word of caution out there. And do you think that these peptides are really, do you think we're really in the early stages of these peptides and that over the next several years, 15 years, they're going to be a major part of recovery and anti-aging?
I mean, I think that, in fact, there's a lot of pharmaceutical companies that are investigating peptides for different disease processes. So there's a lot of peptides that are entering right now into patent protocols for different diseases. For instance, there is a peptide that they're looking at for treating ALS that is entering into phase 3 trials for ALS. There's peptides that are being looked at for antimicrobial, for instance, treating infections that we can't treat. We're seeing this host of infections now that are resistant to every antibiotic that we have. That's a huge problem, is that we're getting this big antibiotic resistance. So there's a lot of peptides that are being explored now as antimicrobial agents that our body, they can still actually be utilized to treat infections. So there are, if you start looking at peptides, there are a whole lot the pharmaceutical companies, the pharmaceutical industries are looking at as drugs. So a lot of the peptides that we utilize are probably going to become drugs at some stage. So these are not, some just being used. The problem is, as we're talking about with insulin, they're going to take a long time for you to get them. So, so there's some peptides that are being, they're in phase 3, phase 4 trials as drugs, as pharmaceutical agents. The drug companies will come out with these. The problem is that it's going to be 10 more years, and the amount of damage being done in that realm and is you're going to hurt a lot of people by how long it takes. So again, right now we can get most of these compounded. We work with really good compounding pharmacies, and I will tell you, to get all the different peptides that we use, we actually use 3 or 4 different compounding pharmacies because there's different pharmacies that make different ones. So it is a tricky process. And I will also add that peptides are a little bit of an art, and that, when you see people, oh, that peptide didn't work for me, sometimes it was the way they used it, the dosing that they used it, they didn't time it appropriately. For instance, if you have a horrible autoimmune disease or you're in really bad inflammation, there's certain peptides that if you throw them into the mix, they sound great, they're all healing, but they'll turn up that autoimmune disease. So we always have to stage things, turn down the autoimmune disease, then work on healing, So it is a little bit more of an art. I always tell people it's a little bit like when my family does a lot of international travel, we do a lot of, okay, you read your guidebook and you go to the Coliseum and you're like, oh yeah, this is cool. And then you kind of walk out and you're like, but if you go there with a guide and they start telling you the stories behind everything, it's a whole new world, right? It's a huge difference. You're also like, wow, that statue is really cool. And when my guidebook was, 2 lines about it. So having a guide going through this process is optimal for doing it. Even though you can go look online, you can find all sorts of stuff. Likely a lot of the failures are because of it is a tricky process. And my peptide specialist in my office, Brian Graham, and I have been doing peptides now for a lot of years. And we still continue to learn, and we're like, wow, why didn't this work on this person? So there's a lot of just trial and error that you have to go along with. And so we try and do that for you. We try everything ourselves first.
Interesting. Oh, cool. Yeah, I like that too. Great. I definitely want to circle back to arthritis and those type of, similar conditions, right? I don't know if you would consider like fibromyalgia, arthritis, like these types of, I think of them as like inflammatory sort of conditions. And the listeners know my story, how I had massive pain and inflammation throughout my hands and my arms. And I would be researching online. And at first I thought I had carpal tunnel. And then I'm like, do I need to get carpal tunnel surgery? And then I would just see horror stories online of people who got it and then still had carpal tunnel after. So obviously that wasn't really healing most people in most cases. Do I have arthritis? Do I have cubital tunnel, carpal tunnel, tendonitis? There's so much information out there. And eventually I realized that inflammation comes from what you put inside your body. And so when I really got that, at first I was trying to do the quick fix. I would buy every pain relief cream, every pain relief device, and all this kind of stuff. I went to chiropractors and doctors, and everyone had a different opinion about what it was. And in the end of the day, I'm really curious to hear kind of, because everyone pretty much knows someone who has like arthritis or one of these sort of inflammatory conditions. How are you looking at those and dealing with those? And I know you have a different opinion about those.
Yeah, so this is one of my passions, actually, because I come from the orthopedic world. It is, you see all these people who come to you with, chronic knee pain, for instance. Mm-hmm. They're like, well, I was a football player, and I tore my meniscus. And so that's why I have arthritis in my knee and why it hurts. And, it's just wear and tear. And it was funny. My yoga instructor was getting her hip replaced. And she said, yeah, my doctor just said it's just a sample of life well lived. And I'm like, it's bullshit. I mean, this is not life well lived. The fact that your joint wore out. So I always try and get people to understand that, does your brain wear out because you used it too much? Or does your gut wear out because you digested too much? It don't, right? Does our brain wear out because we use it too much? Or does our brain wear out because we have chronic inflammation that's destroying neurons for whatever reason that might be? Does our gut start to get dysfunctional as we get older because we chewed too much? No, it starts to get bad because our gut microbiome's disturbed, because our inflammation levels are high. Same thing's true about joints. There are tons of people who had horrible joint injuries and they're fine. Mm. So what we know happens, whether it's an injury that's progressed to arthritis, and that's our goal, so let's try and prevent that progression. But even if we catch it way down the road, right, then we have to say what started the process. And what we now are learning, and this is all really new research, is that we've always put those degenerative diseases into the wear and tear, like the tires on your car. You just drove and they wore out. But what we now know is that in people who have wear and tear, if you look at the fluid in the joint, you just take out some synovial fluid, they have very different levels of proteins that are creating ongoing inflammation and destruction. So now what we know is that there's very high levels of these things called cytokines, which are inflammatory proteins that call into play this continuous process of pain and degradation of cartilage. So you get upregulation of these inflammatory proteins. That stirs up some proteases, these enzymes that are there to clean things up. But I always like to think about these cleanup enzymes as going a little haywire. And just like if you tried to clean the spot on your wall for an hour, you'd finally wear through the wall. It's exactly what happens when these cleanup enzymes get cycling over and over again. They not only try to clean up the debris, they now have destroyed the joint. So, and then we also know there's upregulation of some growth factors that create the big bone spurs and things like that that you see in arthritis. That process is going on systemically. It may get started because you tore the meniscus in your knee. And so that started that inflammatory process, but why didn't it turn off? Why did it keep going? Partly it's your genetics, partly it's your diet, partly it's your environmental exposures. That kept the inflammation going. Certainly genetics plays a big role, but so does what you put in your body, as you've found, right? Right. When you ate sugar and things like that. So that upregulate those inflammatory proteins. And so sometimes simply by changing people's diets, getting rid of those things that are increasing inflammation can be helpful. But we also have lots of things we can do that change that process. As long as you start thinking about it as this is a disease and not simply I used my joint too much, and start treating it that way, we can actually halt and potentially reverse that process.
Interesting. Yeah. I know for me, there's certain things I noticed, like it was like I was eating French fries with my meals, right? And we know how bad and inflammatory fried foods are. I was drinking an iced tea. I bought the iced tea from Whole Foods, right? But then all of a sudden I'm looking, it's like, oh, there's 20 grams of sugar in this iced tea, right? So those are kind of obvious things, maybe cutting down sugar and fried foods. What other things have you seen be kind of potentially game changers or things that have really helped people with these sort of like, again, I look at it same way as you, right? Like anyone who has chronic knee pain, shoulder pain, elbow pain, wrist pain, arthritis, right? You name it, like so many different conditions. They look at it as it's like a problem with that part of their body, but it's really, like you said, a systemic problem, right?
Right. And it's why so somebody comes in and you finally take them to replacing their knee, what happens? Now the other knee goes. And the doctor's like, oh, it's because you overused the other knee. It's not. It's because this whole process is going on. It's why you see somebody who goes hip, knee, you know, and you're just replacing every part. Or somebody has back surgery and then they have another back surgery and they have another back surgery because you haven't really treated the disease by doing surgery. In fact, we now know that if you take somebody who has an arthritic joint and you do what's a common surgery, one of the most common orthopedic surgeries we do is you do what's called arthroscopic debridement, cleaning up the joint. You go see your doctor and he goes, well, you got a lot of arthritis and let's just go clean it up. It's stupid. It'd be like if you came to me with your demented brain and I said, let's just go cut out those bad pieces. It makes no sense, nor does it make any sense. So in other countries, they've stopped doing arthroscopic debridements because they found that in almost 100% of people, they felt better temporarily. The arthritis rapidly progressed. So it's a surgery we need to get rid of. It's not an effective surgery. We need to start treating that differently. So you ask, what else can I do? I mean, from my realm, that optimizing hormones is super, super useful because hormones play a big role in joint health. It's why as we get older, our joints get worse. So,
yeah, I haven't heard many people make that connection.
Right.
Hormones,
but it's
joint
huge.
Health. Yeah.
Estrogen is very protective in joints. So you always think, well, men don't have estrogen. How is that? Well, men do. Testosterone converts into estrogen. So as testosterone levels drop, their estrogen levels drop, and now they don't have the joint protection. They don't have normal, nice, flexible ligaments and tendons. Women need testosterone, just like men need estrogen and progesterone. Progesterone is always thought of as a female hormone as well, but our joints, our brain all have progesterone receptors. One of the things that gives lubrication to our joints is progesterone. So as progesterone levels fall in both men and women, you start to see stiffness to the joints and you start to see more damage. The synovial fluid gets thinner. So you start to see more arthritic pain and more arthritic damage. And so you do need to optimize things like hormones. Vitamin D. Vitamin D is critical to joint health. Number one cause of low back pain, low vitamin D levels. So when vitamin D levels get below 60, you start to see more achy joints.
Even below 60.
Even below 60.
Because I think mine was like 52 or something last time. And
optimal is 60 to 110. I mean, so we know you start to see progressive joint pain gets worse when it gets lower than 40. So you want to make sure you've optimized things like vitamin D and K2. Those are all really important to joint health as well.
And of course, people need to get blood tested, but for the most part, to get to level over 60, you're going to probably have to be supplementing with vitamin D.
Yeah.
Right?
I mean, very few people are going to get there just by being in the sun.
Right.
Especially like you look at me, I'm very dark skinned. If you're darker skinned, African-Americans, for instance, have very low vitamin D levels because we don't absorb as much from the sun. So darker skinned people actually are not as efficient at absorbing vitamin D from the sun. Almost all people, African-Americans, have the lowest level of vitamin Ds. So, and it may be why we see also more progressive arthritis a lot of times in the African-American population. So really key, darker skinned people need more supplementation. We can't get as much from the sun, even though we can go outside. I mean, I never put sunblock on because I don't burn, but we just are not as efficient at absorbing vitamin D from the sun. Remember, you really get vitamin D only from the sun, not from your diet. And we just aren't spending enough time in the sun, especially without sunblock on.
Right.
Because dermatologists hate when we don't wear sunblock. And so now we all have blocked our vitamin D absorption. So most people need 5 to 10,000 IUs of vitamin D. And to optimize its absorption into the cell, you should be taking it with some K2, which is also really helpful for joints. So that is, so that's paramount.
Yeah, I was lower than that before. I started taking 5,000. I got up to 52. And then I said, you know what, let me start. And someone tell me, a buddy of mine who's a physician said, you might want to up it to 10,000. So I'm more recently doing 10,000 on most days, sometimes 5,000. Yeah.
Yeah. I mean, if it's summer and you're in the sun a lot, you can probably get away with 5,000. In the winter, or you're not in the sun, you're sitting under these fluorescent lights, 10,000 probably more optimal. Yeah. So, and people get so scared of vitamin D. It's actually pretty hard to become toxic in vitamin D. You can, I see it rarely. Usually people start getting symptoms of nausea. You stop the vitamin D and they're fine. So, it's gotten this bad rap of, oh, you could become toxic. It's really rare. Some studies have showed you need to be taking upwards of 100,000 IUs on a regular basis to ever become really, really toxic in vitamin D. And most people are going to get symptoms before that. So don't be afraid of the vitamin D. Yes, it's optimal to know what your levels are, but if you don't, you're probably safe at least taking 5,000. And if you're not in the sun, 10,000.
Right.
And the last piece I really want to bring home, because this I see happen all the time. The first thing that happens when you have a sore joint is somebody tells you, well, you need to stop exercising. That is literally the worst thing you can do.
I got that same advice, and it actually, I stopped exercising, and I almost went into like a little bit of a depression, right? Yeah. I felt worse. I felt mentally and physically worse. And it wasn't until I read something else about like, you know what, sometimes it's better to work. And I went back and started working out, and I felt so much better. It's a great point.
Exactly. And the reason that is, and strength training is key here, because our muscles are organs. We forget that, but our muscles are endocrine organs. They are producing something called myokines. So myokines are hormones that basically go to all other places. They basically affect your brain, they affect your bones, they affect your joints. So we've identified about 1,000 myokines that are produced by our muscles when we exercise, including brain-derived neurotrophic factor, which is huge for brain protection. That's why we know that exercise is one of the best ways of preventing dementia.
Right.
But we also know that for skeletal muscle and joints, there's also something called incretins. There's a huge number of myokines that are produced that are actually really helpful for joint repair. So when we exercise, we actually create these myokines that go to help repair the joints. I mean, if you think about that from our body's perspective, of course it would do that, right? Mm-hmm. If we're going out there and trying to beat ourselves up, we need something to protect us. So if you now take somebody and you make them sedentary and you stop producing myokines, you took away the number one thing that was actually helping to protect their joints. And that's horrible, right? So you've got to find, if my knee hurts, I can tell you, I've torn my ACLs 4 times. I've had, multiple repairs of my ACLs. I was in the gym the next day after surgery. You could do one-legged biking, you could do tons of things, so you can't stop strength training. Your listeners who are just going out there, I think one of the things that happens lots of times is people get into endurance training or, cardio training, and it's important, but if you don't have muscles, your joints are going to go to hell, and you've got to be building muscle. And that's becomes more and more important as we age. So we see this whole process of what we call sarcopenia, loss of muscle as we age, that corresponds to a lot of other detrimental health effects, including dementias, arthritis, cancers. So again, myokines are cool. I mean, myokines are these fascinating, hormones that are having a huge number of effects. And it's why we know it's probably the number one medicine, right?
Yeah.
So you guys, whenever your doctor says, you need to just take it easy, I don't listen to that. Don't go, obviously, if you've got a broken leg, don't go bounce around on your leg, but get to the gym and do some upper body work your other leg. If you have an arthritic knee and it's too painful to walk, I promise you can find some type of exercise that's not going to hurt it. And if there's nothing you can do, there's things like power dot, things like that you can utilize to at least stimulate the muscle so you can get that myokine influence. The myokines are critical to joint health, absolutely critical.
That's really, really good information. Yeah. Hadn't thought about that as well. And yeah, you look like you're obviously been doing some strength training. You look very strong as well. Is that something you prioritize in terms of exercise, right? So I really like this. So for those who feel like they maybe can't work out, it's probably even more important for those people to get active and do some
exactly
sort
right.
of thing. Right.
Yeah.
And then it seems like you're prioritizing, and I'm hearing this a lot more recently, like as a common theme, right? Rather than just like, people doing the Peloton for an hour a day, every day, and just doing only cardio. Are you also kind of a fan of prioritizing strength training over cardio?
Yeah, I think the evidence is becoming more and more that strength training is probably more important than our particularly long endurance training. I think long endurance training has some benefits, probably mental benefits. I think that push through things, you learn how to, it's kind of a discipline. It's I can survive things. So, I think there's people who thrive on that, right? You go out and you do your 50-mile endurance race, and the fact that you accomplish that, or your marathons, and I've done that. But if you look at, for instance, inflammatory markers, and you look at a lot of the things we look at for overall health, long endurance exercise is not particularly beneficial there. Strength training, on the other hand, is. We know that, again, this myokine production of bigger muscles, we know that more muscle mass is really helpful as we age. So I think that you have to have strength training, and probably less cardio than we used to think. So, I think that, what I do with my workouts is, and I do one longer endurance day a week, but it's, a little bit more for other reasons. And it does probably help some mitochondrial health to do some, what we call zone 2 training, so just brisk walking. But
zone 2, for people that don't understand that, zone 2 then would be sort of like walking for and then I've heard people say zone 2, 45 minutes, things like that. Like, you can.
Yeah, probably 45 minutes. So what zone 2 training does is it helps with mitochondrial biogenesis. Remember, your mitochondria are your energy powerhouses of your cells. And so we know that zone 2 training helps that mitochondrial biogenesis, and that's important too for longevity. But if you think about zone 2 training, if you don't have a way to measure, if you don't have, fancy equipment to measure it, sort of think of that as doing exercise at the point where you're not horribly uncomfortable, but you wouldn't want to sit and talk to your buddy while you're doing it. That's typically zone 2. So if you're walking and you're chatting with your friend, you're probably not quite in zone 2. If you're walking with your friend and both of you are, you're okay, you can keep doing it for 45 minutes, but you're not going to carry on a conversation. That's typically where you're in zone 2 training. So it's kind of a good way of thinking about zone 2. It's that point before you're super uncomfortable, but you're, comfortable enough to keep doing it for a good 45 minutes. And doing that at least probably a couple times a week is probably helpful. Maybe only once. I think we don't know the true data on that, but I think that that's a beneficial thing. Otherwise, what we really want to be doing is more strength training and high intensity interval training. And they probably don't need a lot. You probably need like a 12-minute program. So what I do is the end of my, I do 2 body part strength training a day. And then at the end, 12 minutes of HIIT training, where you're warming up for a couple of minutes. And then you do a 40-second on, 20-second recovery of, you could be hill running on the treadmill. You could be doing rower, or you could be, and I toss it up because I get bored easily. So, so you do 40 seconds on, 20 seconds recovery. You can download an app on your phone that counts it out for you. So that you download the app, it'll take you through 8 sets, do that 8 times, cool down for 2 minutes, and you probably have gotten really good what you need for sort of fat burning and a good afterburn. So you've built muscle, you've helped the fat loss, you've gotten your cardiac training from that short burst interval training, and then a couple times, or at least once a week, doing some more longer endurance stuff. But that can also be incorporated into just doing walks after dinner, something like that, right? You can do that as, as a 30-minute walk after dinner with your family. My family tries to do that a lot, where we just go out after dinner walking. That's, and we have a big hill by my house, so we can walk up the hill, and, it's hard, but it's not miserably hard with you. So it's pleasant evenings now. So I think that's a good way to think about exercise. And then the last piece is, remember, 2 of the things that go away that also are really harming our health is balance and flexibility. So unfortunately, as we get older, we lose balance and we lose flexibility. And none of those training programs we kind of talked about help with balance and flexibility. So you always have to kind of be working a little bit in that realm too. So I like yoga for that, but not everybody loves yoga. So what can you do? You can do simple things like get a balance board, get a Bosu ball every day, brush your teeth, stand on your Bosu ball, stand on 1 foot while you're doing some of your strength training. Because if you look at old people, one of the things that sort of does them in is they fall, right? And why do they fall? You'll see that even with sort of strong people that they'll fall. It's because there's these little tiny nerve endings that tell us where our body is in space that start to get a little more degenerative unless we train them. So you've got to keep training balance. So the simple things you guys can do is brush your teeth standing on one foot. Those are like simple things you can do. If you empty the dishwasher, stand on one foot while you do it. So those are kind of simple things you can incorporate. But I do like that you've got to work a little bit on flexibility and balance too, because those also start to decline as we get older. And again, if I don't have proprioception, so proprioception is where's my joint in space. If I don't have that, then I'm more likely to injure my joint as well.
Really interesting. Yeah, that's really good stuff. For the average person who, is probably going to not go to the gym more than 3 times a week or something like that, exercise 3 times. If you had to say, okay, they're only going to do 3 workouts a week, what would you advise the average person?
So I think that's where you go, and I think there's some great programs now out there, right? Like F45 and Orange Theory that have tried to incorporate this, where it is kind of a whole body strength training, and then they alternate it with having the cardio, the short burst strength and cardio. And they're like, if you look at Orange Theory now, you're doing 20 minutes on the treadmill, 20 minutes on the rower, 20 minutes of strength training, so you're getting that high interval training and the strength training. F45 tried to incorporate that same thing, sort of the short burst interval that combines strength with cardio. So I think those are great programs for people who want to just have, who don't want to figure things out on their own. It was an interesting study that just came out that I found a little shocking, that they did show that even going 1 day a week to strength train had considerable health benefits. So, so you can do a lot with just a little bit of exercise. So I think, and also you don't have to go to the gym for 2 hours. Right. Most of these programs you can do in 30 to 45 minutes. But what I would tell people is, is focus on if you're going like Monday, Wednesday, Friday to the gym, is to do strength training each of those days. And you could do either full body, arms and legs, or alternate. For instance, you do, Monday you would do primarily your chest and triceps, and then Tuesday legs, and then Wednesday or Friday you would do back, biceps, and shoulders. So now you've gotten your whole body throughout that time. At the end of each workout, doing a 12-minute HIIT training, 8 rounds of 40 seconds on, 20 seconds. You could do that 3 days a week. Huge benefit. And it takes you about 30 minutes.
That's really good. I do want to ask you about, so the HIIT training for me, I found that it really, maybe I'm doing it wrong too, but I was doing about 20 to 30 second, like all out sprint on those treadmills that are like a little different. They're kind of like circular. I think they're meant for sprinting. Yeah. So I would do those 20, 30 seconds, all out sprint, then rest for like a minute or two, and do like 4 or 5 rounds of that. And, normally if I can lift weights for an hour, even hour and a half, and I, come back after feeling energized, feeling, feeling like I have more mental energy. But the HIIT training, I think I've not done it as much as I should, because I feel like it really takes a lot out of me. Do you have any tips or advice for me there, or for the average person who just like doing 4 rounds of all out, sprint or something like that just really drains them?
I think that would, say that maybe you're pushing it a little too hard if you're feeling that.
Yeah.
You should be pushing it as hard as you can, but not to the point where your recovery, you feel horrible, right?
Right.
And the next day trying to recover, trying to get back and do it again. I also tell you that when you're doing HIIT training, you wouldn't really want a minute or 2 minutes in between your intervals. You'd really want more, either a 20-second on, 10-second recovery, or a 40-second on, 20-second recovery, or a 60 on, 60 recovery. But doing a short burst with a longer recovery is probably not as beneficial. If you're doing a short burst, you probably still need a shorter recovery. And that way you're going to find that you can't get back to that really super high level that you just ran at. And it's going to self-limit you a little bit. There's no way, once you have that minute recovery, then you're going all out again. Now you're pushing probably your body each of those times a little bit more. And if you have those shorter recoveries, it naturally keeps you from pushing that hard where you can't recover the next day, right? It's just, you can't do it. You're not going to be able to come after with 10 seconds rest, going back to your hill runs or whatever, you're not going to be able to do it. So I think changing the interval timing would do that. And then I also say, judge how, if you are completely wiped out for the rest of the day after that, then you need to bring it down a notch. You want that stuff to be, hard, but it shouldn't kill you. Nothing you should be doing should make you feel tortured the rest of the day and the next day.
Yeah, that's one of the things I'm starting to learn as well as now I'm 41. But when I was in my 20s, you know, I could go a lot harder and recover a lot faster. But now I'm also realizing, yeah, it's not about just destroying yourself. And I think too many people, I know someone who went from not working out at all to doing 2-a-days with a trainer, you know, and got totally burnt out and got injured and then had to stop everything entirely. And now he's back now he went to nothing right from that. So I think it's much better doing 3 times a week and not just totally destroying yourself.
Not killing yourself. Yeah. I totally agree. I think that's, and when people say, oh, I gotta go to the gym, it's gonna be an hour and a half workout, you know, that's true. You're not gonna be able to do it. You don't need to do that. You don't, unless you're a football player who needs to compete, you don't need to be doing 2-a-day training. You really don't. Right. You know, there's not probably not particularly any significant health benefits from doing that. You know, so I do think there's a little bit of, and remember, injuries will take you back a lot. So there's a lot to, not getting hurt. Right. Yeah. I will say your comment about, well, I know I'm not in my 20s anymore. I mean, that's one of the things I want to get rid of that sort of thought, because I want everybody to sort of stay feeling like they did in their 20s. Right. I would tell you, I'm as strong now as I was in my 20s. And, am I more careful? Yeah, I am, because I've been through a lot of injuries. And so there is a little bit, unfortunately, of your brain that's like, oh my God, I'm not going to hurt my knees again. So I don't ski the way I did when I was 20, but partly that's just this mental piece of learning, right? And my kids go and beat themselves up and I sit there and I'm like, you're going to learn that all this stuff comes back to haunt you. So some of that is simply getting smarter, getting wiser, but you guys don't accept when your doctor says, well, you're doing great for your age. I want to be doing great for the 20-year-old. I still want to be able to work out with my kids and, and show them up, and so that's what I want you guys to sort of think about. It's not, oh, how good are you for your age? It's, no, I'm just good.
I love that. Yeah, that's amazing. I know we're coming close to the end of our time, but I did want to ask you real quick as well about, obviously it wouldn't be a full conversation if we didn't ask you about your diet and nutrition and what kind of you for yourself, as well as maybe what you recommend for the average person in terms of just basic guidelines.
I think honestly, diet is such a really hard thing because, we've all kind of come into this now that we know that calorie restriction, time restricted eating, or intermittent fasting, so eating, in a smaller window, is really beneficial to longevity and autophagy and health, right? And I agree with that. Well proven that, if you do a more calorie deprived diet, that a mouse lives longer, they live better, they're healthier. We know that it induces mechanisms in our body that sort of help us to age more gracefully. So, this whole push to what we call time restricted eating, meaning, fasting for 12, 14, 16 hours and eating within a smaller window. And I'm a big fan of that. The question is, so if you want to build muscle, so if your goal is now to build muscle, how do you do that in a time restricted eating fashion? That becomes a more difficult entity, right? Because if I really want to build muscle, I need probably, a guy your size, 100 grams of protein. Remember, you can only absorb about 25 to 30 grams of protein in one sitting. So if you're eating 60 grams of protein at one time, most of that gets putrefied and turns into those smelly protein farts. And, and so.
Interesting. Yeah, I've heard different things about that. Some people say up to 40, 50. Other people are saying, but yeah, that's interesting.
I think the data is pretty much about 30 grams is about all we can really use at one sitting. Yeah. So how do you do that if you're eating one meal a day or you're eating within a 4-hour window? It becomes really difficult, right? Yeah. So I think the workaround to that is, number one, to go through phases in our sort of training and in our diet, where we go through more kind of maybe a little higher protein build up stages where we're eating in a little bit bigger window. Right. And then using, and I always like to think sort of in 12-week cycles of this, kind of seasonally almost. And then we go through phases where we back down on that protein intake a bit. We restrict ourselves a little bit more. Maybe we lose a little bit of muscle mass during that time, but we allow autophagy in ourselves. We allow some regeneration to occur. So you're kind of going through this, sort of how our ancestors, right? You went through starvation phases and feasting phases, and you kind of do the same thing with our body, where we do a higher protein diet and then a lower protein diet and then a higher protein diet. I think in general, a higher protein, lower carb diet, get rid of all the refined sugars. But I'm not a fan of, going strict carnivore in general. I think it works for some people. People talk about it all the time, right? And they were cured their autoimmune diseases by strict carnivore. I think in general, that a more sensible diet includes some whole grains and some, fruits and vegetables and things like that. And it's very interesting when I look at people's labs. Some of the people who have the best looking labs are the people who just eat a very varied, sensible diet. So I'm a fan of a higher protein, lower carb, but lots of fibrous vegetables in the diet. I'm a fan of varying the time restricted eating or intermittent fasting, maybe quarterly or 3 times a year, doing a longer fast where you're doing a couple of day fast, but that's difficult for some people. So at least for periods of time, you want to get your window eating, your timing of eating down a little bit. So I think that's my approach, and it's all over the board. I mean, honestly, diet's hard because the debate goes on and on and on. Maybe higher carbs better, and no meat is better. And then you have the carnivores who say, no, all meat is better and no carbs is better. And
Right.
there's data to support all of those things. And I think it's going to be a little bit of finding a diet that is sensible and works for you with the understanding that we all know that, polyunsaturated fats, vegetable oils, sugars, they're just bad. Stay away from, the French fries, the refined sugars, the seed oils, the vegetable oils. They're just bad for us. Fats are not bad. Those fats are bad.
Right. Exactly. Yeah. Well, this has been really, really great. Thank you so much for your time here. I do want to, if anyone wants to get in touch with you or learn more from you, what's the best way for people to do that?
So if they just look at our website, boulderlongevity.com, we have tons of information there, and you can sign up and, get a consult, work with our peptide specialist. Brian is great if you're really interested in peptides. He's a guru. And then really encourage you to join our academy. So if you go to bli.academy, you can sign up, you can get a month free on it. And we have all these educational lectures. Like I said, I'm trying to actually teach you guys how do you read your own labs? And, so what is optimal? How do you learn about what's going on in the research realm because your doctor's not going to tell you for another 10 years. And by then you're 10 years older and you've gotten sicker. So we're trying to really bridge that. And I am really fortunate with so I have some group of really progressive doctors that we work together to get this information out. So join our academy, bli.academy, watch that stuff, learn from it. Feel free to give us, you can just shoot up a message online on our website. And we're happy to work with you either from a hormone perspective or a nutrient perspective, peptide perspective. Those of you who are interested in peptides, honestly, do it with a guide. You will get much better outcomes. They're expensive and you're going to waste a lot of money trying to do it on your own. I can promise you.
Well, thank you so much. This has been really, really amazing, very eye-opening. I've learned a lot. I'm sure our listeners have. So thank you so much again for joining us here. And everyone should definitely check out the resources she just mentioned if you want to learn more. So thanks, everyone. And we'll talk to you again soon.
Thanks, guys.
Thanks for listening. And just a reminder, if you haven't yet tried any of our Peak Performance products, you get 20% off your first order. We have one of the largest selection of USDA certified organic superfood powders, as well as very high quality supplements. And you get 20% off your first order at buypeakperformance.com. That's www.buypeakperformance.com.